In 2020, the world was struck by a monster, COVID-19. Some heard of it, some tasted it, some could not tell the story. The aftermath of that epidemic, fear. While COVID-19 is a deadly disease, it is nothing compared to Ebola virus disease or its younger brother, Marburg virus disease. Marburg virus disease is an uncommon and highly virulent disease that causes severe haemorrhagic fever in humans, with a fatality rate around 50%, or had varied from 24 to 88% in past outbreaks, depending on virus strain and case management. The disease is caused by Marburg virus. Marburg and Ebola virus are both members of the Watery family. The two viruses cause clinically similar disease with very high fatality rates. Initial recognition of this disease was two large outbreaks that occurred in Marburg and Frankfurt in Germany and in Belgrade, Serbia in 1967. And the outbreak was associated with lab experiments using African green monkeys imported from Uganda. Why must it always be from monkey in Africa? Why? Anywho, there have been subsequent sporadic outbreaks in Angola, Democratic Republic of Congo, Kenya, South Africa, and Uganda. In 2008, 2 independent cases were reported in travelers who visited a cave inhabited by Rousettus bat colonies in Uganda. In 2021, the Uganda Ministry of Health notified WHO of an outbreak which killed 3 persons. Also, West Africa's first ever case was confirmed in Guinea in that same year. Ghana announced its first case of Marburg virus disease on July 7, 2022. Human infection initially results from prolonged exposures to mines and caves inhabited by Rousettus bat colonies. It can then spread from humans to humans via direct contact with blood, secretions, organs, or other bodily fluid of infected persons and with contaminated surfaces. However, this is via broken skin or mucous membrane. And for the signs and symptoms, incubation period varies from 2 to 21 days. It usually begins with sudden onset of fever, severe headache, feeling of unwellness known as malaise, and muscle aches. On the 3rd day, patient come down with severe watery diarrhea, abdominal pain, nausea, and vomiting. Diarrhea can last for weeks, and patients are described as showing ghost-like drawn features, deep-set eyes, expressionless face, and extreme lethargy. Many patients may develop severe hemorrhagic symptoms, including bleeding from nose, gums, vagina, and fresh blood in vomitus and feces. This usually occurs between day 5 and 7. Involvement of the central nervous system can result in confusion, irritability, and sometimes aggressions. In fetal cases, death occurs most often between day 8 and 9 following onset of the disease due to severe bleeding and shock. Oh, I don't mean this kind of shock. Early stages of Marburg virus disease can be confused for malaria, typhoid fever, shigellosis, meningitis, and other viral hemorrhagic fever diseases, hence its difficulty in early detection. Confirmation of the disease can be made using the following diagnostic methods: enzyme-linked immunosorbent assay ELISA, reverse transcriptase polymerase chain reaction, serum neutralization tests, antigen capture detection tests, electron microscopy, virus isolation by cell culture. Well, in Nigeria and other parts of Africa, this can be very difficult to do. Worthy of note is that sample collection should be considered a biohazard and should be packaged using the triple packaging system when transported. Treatment of Marburg virus disease is supportive, involving rehydration with oral or intravenous fluids and treating other symptoms like fever with antipyretics and pain with analgesics. There are no approved antiviral drugs for treating Marburg virus disease. Now I'm going to group prevention of Marburg virus disease into 3 categories. The first one being prevention of bat to human transmission due to prolonged exposure to mines and caves. During work or research activities or tourist visits in mines or caves inhabited by fruit bat colonies, people should wear gloves and other appropriate protective clothing, including face masks. The second one, reducing risk of human-to-human transmission, which involves reducing close physical contact with patients infected with the disease. Regular hand washing, gloves and appropriate personal protective equipment should be worn when taking care of ill patients. Safe, prompt and dignified burial for the deceased. The third one, reducing risk of possible sexual transmission. WHO recommends that male survivors of Marburg virus disease practice safe sex hygiene for 12 months from onset of symptoms or until their semen tests negative twice.